क्या बोलना चाहता हूँ, जब हमने शुरू किया था 1957 में पापा मम्मी ने, they started with one hospital, and you can see the journey. Now we have got 209 hospitals. Another important point for us to understand is this: out of this, we have many hospitals in Africa. So basically, totally 10 countries. If you see the population, अगर आप देखेंगे, India's population is approximately 1.5 billion. Africa is another 1.5 billion. Total comes to 3 billion. That's nearly half the world. So if we talk about the expansion, आप सोच सकते हैं how much of expansion you can do when you've got half the world requiring right in these two areas itself so much of eye care treatment. Last year, ladies and gentlemen, हमने खोले 45 hospitals, centers last year, and this year we have opened in the first 6 months about 30 hospitals. अगर आप हिसाब लगाएंगे तो you realize we are opening one center every week. Another important issue which I thought we should mention is this: we are trying to create eye care, good quality at the doorstep of the patient. And I give this as an example because you are sitting in Mumbai. If your house is in Powai and you are, let's say, in Nariman Point where you are working here, if some problem happens, you need to have a hospital both in Powai and also in this area location. And that is the endeavor of the group. There are two ways by which such expansion can happen. Let's say in Tamil Nadu or Chennai where we are, if you open green fields, it's very easy for us to open. And if you open a new state, let's say when we open Maharashtra, the first would prefer to be an acquisition or a brown field. So we have the combination of both. And when I was telling you about expansion, हमने वाराणसी में भी खोला है अभी latest एक hospital which is doing very well. So you can see we are not in Delhi, Uttarakhand, Chhattisgarh, so many states we can mention. Even in the existing state जहाँ पर हम हैं, we can expand so much more. Important for us to understand another important aspect, and then we move on to the numbers by Dr. Adil, is innovation. अगर आप देखेंगे ये कैमरा आप पकड़ रहे हैं, कैमरा के जो भी आपके फोन हो या कैमरास हैं, they all have lenses. So imagine अगर आपका लेंस खराब हो, you cannot see through that. You cannot focus through it. So you have to replace that lens by a new lens. वैसे ही हमारी आंख में एक लेंस होता है. That is how I am able to see you all. Or if that lens becomes cataract, जैसे बोलते हैं मोतियाबिंद, and it's an aging phenomenon. It will happen to everyone with age because like our hair grows, the cataract forms. We remove it and fix another lens inside. Today we brought out a technology some 15 years back called glued IOL. You can Google it, G-L-U-E-D, glued IOL. The principle is this: if somebody has an injury or some trauma or some complication has occurred where a lens cannot be fixed, today with glue or gum, we can fix a lens in the eye. Another big innovation for us to understand here is pinhole surgery. देखिए सामने जो विंडो होती है इसको बोलते हैं कॉर्निया. That's a window of the eye called the cornea. If that gets damaged, we have to replace it. मतलब eye transplantation करना पड़ता है. But today, what we are doing is we are doing a pinhole surgery where we create a pinhole so that with this we can avoid eye transplantation. So, ladies and gentlemen, this is in a gist what I have been trying to tell you about what the group is endeavoring to create, what it has created, and the innovations and the things behind it. I also request now Dr. Adil to come